My name is Tembi Aris. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists. People call me Dr. Alternative out of endearment. The health industry, or health, has got two dimensions: the alternative dimension and the medical dimension. But unfortunately, these two dimensions don't talk and they don't collaborate, to the detriment of the recipients, that is the patients out there. I am the epitome of these two dimensions.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
April is a month of tourism where we create awareness about this condition. It is a condition that brings a lot of sadness to many parents. Once the child is labeled autistic, does he have a future? Does he have an option of having a career? Or is he done? So in this show, we're going to be bringing you various scenarios and various cases so that you see that your child is not done just because he's labeled autistic. But we're going to be bringing you some fresh perspective from the alternative side, where we will be bringing answers to questions that you may be having, which you never thought actually existed. We will bring you different scenarios and different cases that we have taken from point A, and you'll be able to see the transformation from where we took them up to where they are today. Make sure that you watch the show, because it may be a source of hope to those that lost hope about their children. Welcome to our show. As I introduced earlier, we are talking about autism, and we're going to be covering autism throughout this month of April, as it is a month of autism awareness. With me here are the ladies who are going to introduce themselves.
Hi viewers, my name is Sharelle.
Good day viewers, my name is Nasmusiso.
The method we're going to follow today is we have selected two different cases that Sharelle and Busi are going to present to you. They will map out who and what they were suffering from when they visited us to ask for help. And then I'm going to give the diagnosis and how we started working with them from that time up until now, and where are they and how are they today. So over to you.
Okay. So from our list of children with autism, I've selected this particular one. A young boy who came to us at the age of 10 years old. He was diagnosed with autism, and he had no interest in anything else other than what he wants to do. He didn't like watching TV or cartoons like most kids his age. He was antisocial because he couldn't communicate, only understanding basic instructions given. He was also a big eater, but nothing healthy, which led to him being chubby. He was put in a school for autism, but the mother ended up taking him out as she felt that the programs offered at the school was not helping her child at all. He was not happy attending them, and he ended up getting frustrated and having emotional outbursts and withdrawal symptoms. It is at this stage that the mother heard about alternative methods and decided to come to us for further help. And you are probably wondering what we have to offer, because once a child sits with a diagnosis, then that's it. So you are probably wondering what we have to offer, because once a child sits with a diagnosis, then that's it. So watch our show to get your answers.
That is the first patient that we're going to be talking about, as Sharelle has presented him. Now this child, when the mother came to me, she did have some idea of what we are capable of doing, but could not really ascertain to what extent. Okay, could we make the child talk again? Or could we make the child have a better understanding, maybe eat healthy, not be so much into junk, stop the tantrums? And but the question that every parent wants to know, is he ever gonna talk? Those that are totally nonverbal, is he ever gonna talk? Okay, and if he's talking, is he ever gonna be attending a normal school? Okay, and those are the questions that I find a lot in parents, particularly the one, is he ever gonna talk and interact with the parent? Okay. So now my diagnosis, as you understand that, I scan. Some of these children that are autistic, you find they're very hyperactive. Some of them are very anxious when they are brought to an institution that they associate with medicine or nurse or doctors, because some of them have been to so many institutions and getting injections and all that. So then you find that there are those that will totally refuse to cooperate. But this one was very cooperative, and he had a very good rapport with his mother. If the mother says, don't do this, he would obey. So I actually admired how she was relating with her child. And I could even relate to why she picked up when the child was not happy at school and decided that this was actually a better option. Whether it was, you are the judge for that. Because when a child is autistic and you take him out of school where the belief is that there are programs, there are occupational therapists there are psychologists, there are physiotherapists, I mean, you name them, they've got all kinds of therapies that are deemed to be appropriate for your child. So when you take him out of that and rather prefer him to stay at home with the helper, it means you really have got a very deep understanding of what matters to your child and what doesn't. So this is a decision that not many parents would actually arrive at. So I really admired her courage and her conviction about a decision. Now, what did I diagnose? Okay. Now, this child, I diagnosed him with mucolipidosis. Mucolipidosis. Now, what is that? Mucolipidosis is actually a metabolic disorder. Okay, it's a genetic one, and it's a metabolic disorder. And I remember when I shared this with the mother, mapping out the different types of symptoms that followed, she actually said he's probably taken this, inherited this from me, because I can relate to some of the things that you're mentioning. So he had this mucolipidosis. Now, mucolipidosis, as I've said, is a metabolic disorder where the child battles to break down a certain type of fats. Okay. In fact, let me say lipids. Now, remember, when we eat food, there are certain different types of enzymes that will channel where a certain type of chemical processing should occur, how it should occur, and once that has been achieved, and then it moves on to the second one, or next, depending if it's a chain kind or what kind. So now when you've got mucolipidosis, it's when the process that directs fat, because remember, and it happens at a cellular level. It doesn't happen at the organic level, I mean at the organs. It happens at the cells that forms those organs, those tissues, those bones. So it happens at a cellular level. Now remember, the structure of the cell has got different bodies. The inside of the cell is loaded with proteins, but the cell is covered with fats on the outside. But all those processes must occur as naturally prescribed by God, who created the body. But there are certain enzymes that are catalysts that help with the processing of those of those processes. So when you've got mucolipidosis, therefore you're lacking those enzymes that assist with that, okay? And as a result, it's the digestion that actually occurs within the cell itself is messed up. Now, those structures are called lysosomes. Now, lysosomes are responsible for the digestion that occurs within the cells. Now, remember, digestion is the breakdown of food from its state into structure, into energy, so that it can be used by the body. The fruit, you break it down into sugar, and that sugar is converted and is used by the body. So that's what happens, therefore. So when you've got this problem, it's a lysosome disorder. It's even called LSD, okay? It's lysosome disorder. And as I've said, lysosomes, they are responsible for carrying the enzyme that helps with the digestion that must happen within that cell. So when that's not happening, therefore, you actually sit with an accumulation of fat structures and complex carbohydrates. And that's a problem, because then those fat structures, especially lipids, they will accumulate wherever they decide to accumulate. Now, in most cases, those fat structures actually accumulate in the carotids and blocking the flow of blood into the brain. Now, remember, the blood that is carried by the arteries is carrying those food, it's carrying those hormones, is carrying the medicine, is carrying everything that is needed in that particular structure or in that particular organ. So when there's that build up of those structures, of those fat structures, it obstructs that flow of blood into the brain, which brings all the other necessary stuff that the blood is carrying. So people with mucolipidosis, therefore, will have issues with the ears because it affects the carotids that serve the temporal lobe. Now, temporal lobes are these lobes on the sides. We've got both right and left temps, and those temps, they carry certain functions. Your emotions are managed and regulated there. Your memory is regulated there. Your sound, as you see that they actually run behind the ear, the sound is regulated there. The oxygen to the brain, that's where it's going. So you'll find they will have speech problems because the speech is also partly regulated there. Even people that are older, once they have the issues that temper with temporal lobes, then you'll find that they will have issues of dementia. They will have issues of speech. You know, those people that you find, some of them may talk too much and over-explain instead of getting to the point. Some of them, most of those people, I usually pick up to be having issues with their temporal lobes. They will have issues of emotions. You find you cannot make them angry because once they get upset, they really go mad. So those are the type of symptoms that you find among children that are autistic. They have got emotional, they've got tantrums, they've got outbursts, they cannot talk. Not some of them, it's not because they cannot talk, because there are issues with the vocal cords. The vocal cords are kosher and everything inside the vocal box is kosher. But the problem is in the temps, so they cannot hear. So the sound processing is compromised. And because they cannot hear, when you say mama, they cannot hear. Even when they end up getting to hear, some of them, they cannot process that information, so they don't understand. So that's why you find, therefore, that children that are autistic, they tend to have issues that are very similar. Okay. Even when it comes to epilepsy, because most of them, they are epileptic, but they're epileptic because they get temporal lobe epilepsy. Okay, so some of them tend to have epilepsy at night because even in cases of, not this one, but I've had a few cases where I would tell a parent that your child is having seizures. They said, no, my child is fine. Because why? Because they're having seizures only at night, which is a nocturnal temporal lobe epilepsy. So he was therefore in that category. Okay, so that is what was causing him to have these issues. Now he was picking up weight, like Cheryl was listing some of the symptoms that he was experiencing, that he was antisocial, he did not want to, but because he did not really understand what was, he had no interest in watching television, and because he didn't understand. If you can't hear what's saying, you just see lips moving, you don't even, you can't process. So it's of no interest to him. So it followed that, he had to have, he was picking up weight because of the lipids accumulation, because he cannot metabolize fats, lipids that well, even the carbohydrates, complex carbohydrates, which are also part of the type of food that needs the enzyme that's produced by those lysosomes. So, and you find then it gets converted into fat when it's not properly digested. So that is why he was having all these symptoms. So now what did we do with this? Now, this was not only affecting his temps, but it was affecting also even the brain stem. In his case, it was not just temporal lobes, also the brain stem. Now remember, even the brain stem is also part of digestion, of metabolism. Why? Because the medulla oblongata, which sits at the base of the stem, is responsible for digestion. Okay, it's part of that, and it's responsible for the heart. Okay, so he was sitting with those conditions. Also, his spleen was a bit enlarged. The splenic veins were kind of blocked, which is why he was such a picky eater. Because the spleen, once the spleen is enlarged, you'll find people get full very quickly. And therefore, that's why you'll find they will just nibble there and there, because then they get full. So he was also sitting with all those, those symptoms. So that is what I picked up, which was explaining why he was presenting with those symptoms. So what did we do with him? Okay, so how do you deal with a child with something, a condition that is actually metabolic, genetic? Okay, it's at cellular level, and. So I will not get into detail of the actual prescription, but it was a battery of a cocktail of products that I put. So because firstly I had to break down those fat structures. Okay, so to ease that build up that occurred in his carotids. So I had to break down those fats. I had to help his metabolism, not just only at cellular level, but metabolism in general, which involves your nitric oxide, your thyroids, which involves the spleen. I had to clear that spleen because it was also making him become a picky eater, because he gets full very quickly. Even though he was a big eater, but he would fill up, eat big, but that full small, then he wants to eat again, but small, as quantities. So I had to clear all that. Now, so in a nutshell, I will give a brief combination of protocols that I provided him. Firstly, I had to sort out the metabolism. So those fat structures, I had to make sure that we break them down. But then I would help him with additional enzymes, because he's lacking the enzyme that's assisting with digestion at cellular level. So I assisted him with some of the enzymes that are actually a cocktail of enzymes that would assist with that. There are certain enzymes where you can provide something fictitious that assists with metabolism, but there are certain enzymes which you cannot supply. Like, for instance, aldolase enzyme. You cannot have a supplement for aldolase enzyme. So once a person is fructose intolerant, then that's it. But then there are certain enzymes, like for instance, in this case, where you find I could augment, So and then I work on that brain, because remember, that brain has been sitting with that slow input of blood flow because of the build of those structures. So the memory is messed up, concentration is messed up, the emotions are messed up, the understanding of processing the information, even the cells themselves. Because remember, for that brain to be able to develop, you need to have the growth hormone that assists with the development. So that also gets compromised when you've got such a bad supply of blood flow. So I had to provide him with all that to assist that brain. And then the mother gave a report to say, he is starting to mimic us when we talk. When I say something, he's also, even though you can see that he does not even understand what he's saying, but it means he can hear now, So, and not only can he hear, he can not just only, because even initially the mother could still give him instructions, move this, move that, but now he can mimic. So in a way, he would not just only hear, but he would also be able to hamba, and then he says hamba. And that was the word that the mother said he used to, hamba, and he also says hamba. Meanwhile, he never used to do it in the past. Even finished, because you remember, she said she gave him a container and it was finished, and then he just threw it away and he said finished, and said it in English. So she was kind of fascinated to see that he is actually starting to learn to talk, even though talking in his case is just mimicking, just like parroting what the mother was saying. Then he started, and then he lost weight. She said he lost weight. Then those emotions where he would, the tantrums, he became calm, he lost weight, and he started sleeping better. He started sleeping better. So she was quite happy and that was now within 2 months of us administering this cocktail of protocols. So, but we've been working with him throughout, because we started in July, it's now March, and she has even taken him back to school. Okay, she actually took him back to school, and she was anxious how he's going to cope. At the first few days, he didn't cope. He became irritable, and such that she sent me the report that came from the teacher, because she expected that now when he goes to school, because of all these milestones that he had reached, he was now going to be, So she was kind of disappointed when the teacher wrote a negative report that he was irritable, he didn't want to, cooperate, and, so, and then she, the report was negative. It was not a positive report from the side of the teacher. And I said to her, no, you don't have to worry, because remember, he's been taken away from all that stimulus, all that pressure from other kids, he's been sitting in a quiet environment at home, an environment that he's used to. So it's still a shock for him to go back to that, and he can still remember how it used to be. So give him time. And exactly, he has now adjusted to the conditions, and she was saying, not only is he still continuing to imitate and parrot talk, but now he understands. She said he used to not know the left or the right shoe. He used to, keep dressing, but now he knows this is the right. And she says, I watch him. And when he comes from school, he takes off his uniform, he folds it, he knows where he must hang it in the wardrobe. And then when it's time at night, he knows pajamas, he knows these pajamas, this is for sleeping, and we'll put his pajamas and hang. And she says he's actually quite a particular boy that I'm noticing. And then he would hang, and then the shoes, he put them nicely there. When it's time to wear them, he wears the right foot on the right shoe. She says he has progressed. It's actually so mind-blowing how in a period of 7 months, because it's 7 months, that he has progressed from this. And now at school, he is attending school. Normally, all that irritation and nervousness and all that, he has totally settled, and he's enjoying his school. So that is, but he's still not talking sense to her. But he can utter words, he can repeat, he can, so he just needs to connect. So we only need now to connect, which is not something that's going to happen immediately, because for him to understand that brain, remember, this brain has not been able to process, but now it's starting to process that, when you say hamba, you're saying go. So he knows now when you say hamba, you're saying go. So he will say hamba and get up and hamba, so he is starting to connect the dots. Okay. So that is the milestone. Those are the milestones that we have realized since we started with him till today. Let's go for a break, and when we come back, we look at the next case.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to adolase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat.
Welcome back. We are talking about autism. Since this is an Autism Awareness Month, when we went for a break, I was presenting a diagnosis and treatment program of one case that we selected from our clientele base. We are now going to move on to Busi, who will present the second case.
We have a 6-year-old girl who was diagnosed with autism at the age of 3 years by a psychologist. She attends autistic schools. Before she came to us, her symptoms were she was struggling to sleep, and the mother was not sure if she was struggling to sleep because of the blocked nose. She was snoring, she was non-verbal, and she was a picky eater. Sometimes she doesn't follow the instructions. Coming to you, Mama. In autistic schools, there are programs set aside for autistic children, and it is every parent's wish to take a child into that school, because there are different types of practitioners like therapists, psychologists who can deal with a child. Viewers at home, probably they are wondering, what are you bringing that will make a difference in child's life?
Yeah, that's as I've indicated in the previous case, even with this one, because this one, as Busi says, she's still at an autistic school. The mother did not remove her. She just accepted that this is it. Okay. Now with this one, I diagnosed her with mitochondrial dysfunction. Now, what is that? Now, you see, every part of the body is made up of cells. Every part of the body, even the bone, because people say, even the bone, every part of the body is made up of cells. Now, these cell structures have got their own structures within the cell, like they digest food, they change energy, converted it from this to that, they change food from this to that. So they need a complete processing of all these chemical processes to be able to make themselves as cells. So that when you say my skin is the cells of my skin, they need to be, like for instance, people will say, I need to exfoliate and remove the dead cells, because that's the cell process. The cells are made, and when they are made, they must eat, they must convert energy, they must make sure that they survive and do the function of that particular cell, and they must die. So when we say you need to exfoliate, it means those dead cells must be removed. The cells that are worn out must die. Sometimes they are recycled. So all that process is happening within the cell. And then that cell makes or is available to make, because if it's the cell of an eye, it is made as a cell, but to be part of the structure of that particular eye. So it's a very complex process, so when you've got issues with your eyes, you must know that it starts with the cell of the eye. You don't just go to the eye, it starts with the cell. So when you've got a mitochondrial disease, therefore, you are facing serious problems. Why? Because it's like, for instance, if I may make an example, that if you're building this room, you need bricks. Now, these bricks must be healthy for you to be able to build a structure that's going to stand. So if one brick is faulty, that's why you find they will throw away bricks that are faulty, because it's going to mess up the whole structure. So when you've got a brick that is faulty, you need to, whether you cut the part that's broken or you do whatever, when you normally see people chipping it and whatever, you're making it so that it fits the space where it is supposed to sit, to make sure that it makes the whole structure proper. So the cell is like that. The cell is like a brick of the body or of that particular organ. So the cell itself, just like the brick is made up of water and cement and whatever else is. So when the water is not mixed properly with cement, then maybe it makes a brick that's not gonna hold. Maybe that will break easily or whatever. So the brick itself has got its own ingredients that are important to make it a good brick. It's the same with the cells. So when you've got a mitochondrial disease, you've got problems at a cellular level, which mess up a whole lot of things in the body. So this particular girl, when I gave this result to the mother, she said, you're actually mentioning something that was mentioned, I don't know by what. She told me that she did take this child to another alternative practitioner, but then she said those people, I don't know if they use the saliva to analyze or they use the hair, but they use something different from our scan. And she said, they told me that this child has got mitochondrial disease, but they gave me some drops which never really helped. But they told me that it's going to be a difficult one. So the fact that you are mentioning this is actually sealing the diagnosis, because this is something that I'm not hearing for the first time. But the difference with me was I had programs that I was going to follow. So this child was sitting there with this problem. Now, this mitochondrial disease is what was causing her to have the metabolic, issues. Like I say, it's a metabolic disorder. So the other things that I picked up, she had a brain calcinosis. She had brain calcinosis. And what does that mean? There were some calcium crystals that were deposited in her brain, in her basal ganglia, in her brain. But and she had quite a number of crystals that were actually sitting there. But what would cause her to have, now remember calcium is a mineral that we get from food, that is food for the bones. But it's transported, it's absorbed by the small intestines, but it's chemically processed by the thyroid, but it's managed, the levels are managed by the kidneys. But the mitochondrion is also responsible for some of that digestion of calcium, and storage of calcium. So she was sitting therefore with the dumping of calcium in her brain, which was as a result of mitochondria, not because of kidneys or thyroid or even small intestines in this case. In her case, she was having calcinosis because of this mitochondrion. It was storing too much, and then those crystals were actually sitting in her basal ganglia. She was also diabetic. I remember, but her diabetes was not because she was not producing sufficient insulin to break down sugar, but it was because glucose metabolism was compromised at a cellular level because of this mitochondrial disease. So, and the mother said, when she gets hungry, she will go to the kitchen. I mean, this is a 6-year-old. She will go to the kitchen and she will ransack the cupboards, and she would even eat paper. She said she would even eat paper, And when she drinks water, she's just galloping. I mean, as if she's never gonna have water afterwards. And I'm saying it's because of diabetes. People that are diabetic, they eat a lot. They get hungry quite often and they get thirsty. So then I would, but then in the treatment, I gave a whole lot of protocols that would help with that. And also she was struggling to sleep and she was irritable. Now remember, the irritability was particularly because she was now having these issues of brain calcinosis, or that would make her to be irritable. Even at school, the teachers were saying she gets so irritable and she gets so emotional. When she cries so much that you don't even know how to pacify her. So also the eyes, I did pick up that she was also having issues with the eyes. And her brain, she had brain atrophy. Her brain size was slightly, not largely, but was slightly smaller than the normal size. So she actually had brain atrophy. Okay. So when I gave her the treatment, therefore her treatment, actually the other thing that I did not mention was that she had metal intoxication. And I asked the mother, because remember, people that will have metal intoxication are people that you find either they're exposed to asbestos, if maybe the roof is asbestos, or they're working in areas where, like, for instance, the police, those people that do a lot of gun shooting, whether they're practicing and all that, you'll find they tend to have quite a bit of metallic intoxication because of all that gunpowder and all that. Or people that work at pharmacy, not pharmacies where they produce certain chemicals. Then you find that if they're working with that chemical on an ongoing basis, then you find that they will have metal intoxication. So, or you're staying in an area where traffic, because I remember I had one lady in Pretoria who was so metal, and it was actually a parliamentarian. She says, no, but I work in the office all day, so where would I get metal? And she was heavily metally intoxicated. And the symptoms, she could relate to the symptoms, only to find out her house was along the freeway. So the cars that were, all the fumes that come from that exhaust and all that, she was carrying all that. She sold that house immediately, because she did not realize how much damage it was causing her. So what I'm getting at is that people get a lot of metal intoxication from these various sources. But in this case, so I asked the mother, and she said, no, we're staying on a farm. But a farm, it's even better environment because there's more air there and, oxygen and water. And then she remembered that, before we moved to the farm, we stayed in a house that had asbestos, roofing. So that child was still carrying that metal from that asbestos, and it was affecting him, particularly also with the snoring and all that. So that was the cause of that congestion. Now, in a case like this, how do you start? Where do you start with mitochondrial disease? Because, we're talking cellular level, we do have protocols that actually work at the mitochondrion, starting with the mitochondrion of the heart. Okay, so I put her on that program, even though the supplier had produced this product for the mitochondrion of the heart, which is very important actually, because remember, the heart is the power, organ that pumps all that blood that is servicing the whole body. So that's why I concentrated on the heart. But then I said, if it works for the mitochondrion of the heart, it should work with every other mitochondrion. Okay. So, and then I prescribed this, I dispensed this for her. I gave her a treatment for diabetes to stabilize sugar. I chelated the build up of of metal. I cleared that, and then I sorted out the calcium build up, the calcium crystals in her body. But then I gave her some anti-glycosylation programs as well, protocols as well, even though she doesn't have glycosylation disorder. But because she was sitting with metabolic disorders because of the mitochondria that were messing up the synthesis of sugar with proteins and lipids, even though the problem was not from CDG. So I gave her those protocols. And all that worked like a bomb. Then I gave her some vitamins, supplements to kind of beef up the brain cells, because like I said, the brain, she had atrophy. And I worked on the alpha cells, try and beef up the alpha cells and tame the delta waves of the brain, so that she could be calm, beefed up the theta max, because they regulate your sleep waves. And then she started sleeping, she started sleeping well. And then I also helped in taming the hunger pangs. But this time the hunger pangs were mostly from the inability of producing enough hydrochloric acid. So I gave her a stuff that beefed up the hydrochloric acid so that it would assist with the metabolism. Okay. So, and then the mother said, she started becoming calm. Even the teacher sent a voice note, the mother forwarded it to me to say, hey, we are observing this child that she no longer, because in the past she would cry, you would not even know how to pacify her. But now, even if others, they come and they provoke her, she just looks at them. And when you watch how she's reacting, she does not look frustrated. She just ignores them. She says, this is something that's like really fascinating to us, that whatever this child is taking is working so well for her. They started reducing the thirst that was now like also uncontrollable. She started drinking normally. She started eating normally. And the mother said, what I find interesting is that even though she was eating so ravenously, she was eating she would even eat papers, but she was not eating certain things like vegetables. She was eating these things like, like your junk, but she would eat like crazy. So she said, so she's eating lettuce. Who would have thought that lettuce, many people don't count, but she says, I'm so shocked that she's actually eating lettuce. So she was so impressed with the progress. And then she finished the medication, and then she said, what other protocols? And then she phones me panicking. She said, this child has been doing so well, and now we allow her to watch television. Now she's even watching television with us. And then she said, sometimes I would be sitting with my daughter, her elder sister, and we're chatting. And then she would walk in looking so restless, and she's crying. She's scared. You don't even know what has happened now, you know. And I said, would she be watching television? Because this is the other thing that I've consistently found among children that are sitting with autism, is that you find that the parent will say, he didn't care about television just like the previous one, or he was watching television or what, and now he's interested in television, but now he happens to get so overexcited, and he was like the one that would repeat. And then this one, she said, she comes from watching, then she's like scared or shaky and crying, but not like very badly. But she said, and we don't know what happened. And she now, remember, she cannot say anything, so we don't know what could be happening. Such that one parent even thought, no man, there's some witchcraft that's happening. Maybe some people are not happy now that they see there's progress on my child. Now they are bewitching my child because he will be looking at it as though he sees something. He is having a seizure at that time. I said to her, she's watching television that she never used to be that interested. That television, particularly for children that have got mitochondrial dysfunction, they have some seizures that are called myoclonic seizures, which are stimulated by whatever. It may be something that is exciting that stimulates the seizures, or it may be, I say, it's the television. So take her away from television, because it means she's getting myoclonic seizures. And then I started giving a treatment for epilepsy, because to tame that brain from being flustered. And then she calmed down. She said, no, she's not doing that anymore, but we're not allowing her to watch TV. Then I said, you can try and see after a while of me administering this, to see if she improves. And then they say, no, she's actually improving. Now we watch, although we don't allow her to watch that much. Okay. And then they continued with the program. And then all of a sudden, again, she calls and she says she was doing so well, and again, and then she's now starting with the ravenous hunger again. So now she was eating normal, and then all of a sudden she's eating like crazy, and then she's drinking and back to square one. And then I said, no, bring her to the scan so that I can see, because I haven't seen her for some time. I've just been giving her some programs. Okay. She did bring her to the scan. Okay, so the latest scan, I picked up that the ravenous hunger was not now from the hydrochloric acid that was on the low, but she was actually having what we call leaky gut. So I didn't need to beef up the hydrochloric acid. I just had to sort out the leaky gut. And then she said, no, she's now eating well again. But now the sleep, in the sleep, I gave her, I did not give her the stuff that was now stimulating the brain, but now I gave her stuff that would work on the feel-good hormones in her pituitary gland. And she said she has started to sleep well again. So what I'm getting at is that with these kind of conditions, it's not something where you can just say, okay, I've sorted out the mitochondria now, the damage that's caused by it, then it's done and dusted. No, with conditions like mitochondrial disease, it's an ongoing program where you have to keep on checking. As such as I did tell her that she needs to come maybe every 3 months so that we see where is it focusing now, because when it is at a cellular level, you don't know which cells are going to be exposed this time. But there is so much progress. The child is calm. The child is engaging. But she's in her case, she's still not uttering words. It's different from the previous one where he's talking and he's mimicking. She's still not uttering words. But I'm continuing with the program. And then we see, maybe when we present again, I will talk about, maybe I'll give her another 3 months to see if she ever utter words. Because with children who have got mitochondria, and you find some of them, it's not just only a problem of input, it's also a problem of output, where you find they've got what we call vocal malacia, that makes the vocal cords to be flappy, you know, so that and not strong enough, because when you make a sound, you need to be able to push the vocal cords so that they allow for the voice to come out and then go back again. But when they are flappy with malacia, you find that they cannot sustain that output. Therefore, the voice does not actually give the sound that is necessary. So in a nutshell, what am I saying? I'm saying with every autistic child who sits with that diagnosis, we are in a position to identify what is causing that condition in that particular child. Because like you see, these are two different scenarios, but they're both sitting with autism, okay, with the same diagnosis. Some symptoms are similar, but they've got different types of causes, and as such, different types of treatment protocols. So we hope this has given some clarification, but don't be despondent out there if you are a mother of a child that is sitting with autism. You can catch us on our Facebook page, and you can contact us. You can send us some questions if you want, and we'll be able to guide you and to say what. Also, the other thing that I'm very big on is guiding you on what to feed. I tell you what you must not give and what you must give. And in some cases, I was even doing the program to say per week, on a daily basis, this must be the breakfast, this must be the lunch, this must be the supper, this must be the supplement. That whole program, but it's very taxing on me, so I'm not doing it anymore. So I will just give you a ballpark guide as opposed to detailed guide. But don't be despondent. There is big hope, and we're making some serious transformation in your child's life. And thank you for watching, and goodbye.
Thank you for watching, viewers. I hope you've enjoyed and learned a lot.
Thank you for watching, viewers. Enjoy the rest of it.